Singapore is spending one of the longest periods of restrictions if you compare to the rest of the world. Why is that? Is Singapore being overly cautious, or is the situation in Singapore just much worse than everywhere else?
Hi, yes. So to answer that question, I think every country's strategy is basically different, and we are essentially reacting and responding to the situation as we see in Singapore, and we are trying to control the spread of disease through a containment strategy, and that's through testing cases to detect them, doing contact tracing, quarantine of contacts, and also conducting surveillance to identify cases as much as possible. And including, in addition to that, we have rolled out many community-based measures to reduce the spread of disease, and that has been very effective in bringing the community transmission rates down substantially.
Singapore's waiting for cheap and fast test kits. How far away are we from that?
I think there are many test kits on the market at the moment. The tests that we primarily do are still the PCR-based laboratory tests, and also we are including serological tests in our testing portfolio as well. But there's a lot of research going on. Of course, we are always looking for better, more effective, and more efficient testing methodologies. So we have to look at what are the research being done on the horizon, and to validate these test kits and see if they are able to be incorporated into our testing strategy.
Where's the best hope for these test kits, Dr. Lee? Where will they come from?
So I think there are a lot of research going on internationally at the moment. So, it is difficult to determine exactly, where the next advancement or developments might come from. So we are not, looking at only one setting to identify new technologies. We are looking all across the world to see what is the latest technology, where these technologies can be produced in scale to meet our requirements, and also in a way to hedge against the various risk in terms of both supply and also in terms of the effectiveness of these test kits. So right now we are continually ramping up our testing capacity in Singapore. We're conducting more tests every day, and but testing is only one aspect, as I've mentioned, of the fight against coronavirus. Testing only enables us to identify cases, but there's still a lot of work to be done in terms of investigating these cases, performing contact tracing, and other public health measures, such as encouraging the public to have good, safe management measures in terms of having safe distancing, practicing good hygiene, and also to report any respiratory illness to the doctor as soon as possible so that they can be treated and managed. In addition to that, testing also allows us to identify cases so that we can manage them clinically and reduce any complication rates or even mortality. And that's what we've been doing in Singapore. Identify as many cases as possible, but then we manage them as best as we can with the latest in our ability to deliver healthcare to these individuals to lower complication rates. Over.
Vernon, it's Rashad in Hong Kong. What steps, what are the, I suppose, measurable goals that you have to reduce the circuit breaker and the lockdown? It's a gradual process, but what sort of milestones do you have to pass through?
Yeah, there are many indicators that we have looked at. Some are sort of technical epidemiological indicators, such as the number of cases, how many cases we are able to link, and also through our surveillance and modeling of the reproduction number and so on, how these point towards decreasing number of cases in the community. But the other indicators that we've also looked at are things like, whether, we have rolled out, sufficient messaging to the public, how is the public, adhering to these, safe management measures, is businesses able to cope with reopening in this environment, and also things like whether the healthcare capacity is able to deal with any coronavirus cases that might occur. So as you can see, we have already announced that we will be progressively opening the economy after the circuit breaker.
Vernon, what have you learned about this disease in studying patients? We know about in northeast China the whole virus has actually mutated. Are you seeing any evidence of that? What have you learned in terms of people who've had it? Are they also still able to get it? Is it communicable even if they've recovered from it and are testing positive, for instance?
Yeah, no, we're constantly learning more and more about this disease. I mean, it's a very new disease, compared to many other diseases that we're familiar with. And with any new disease and the amount of research that's going into it, we will always, discover sort of interesting or rare phenomenon. But I think much about this disease is still what underpins the overall, response strategy, which is that, it mostly spread by droplets and also through contact of contaminated surfaces. The disease tends to be, very virulent or transmissible early on in the illness phase or even in a pre-symptomatic phase. And that's why, rapid identification of cases through testing is extremely important. And, and so that sort of underpins our overall strategy. We're always monitoring for new pieces of information and to validate them and to incorporate into our strategy. But we're watching this space very closely.
Dr. Lee, also just quickly, what are you doing to improve the lives of these migrant workers, which really gave the second wave to Singapore ultimately? What are you doing about people who had, in essence, according to some critics, had been forgotten, people who'd been forgotten?
I think there's a whole stream of work that I think various agencies and various people in Singapore are actually looking at this. I'm not in a position to comment since this is not really in my specific area of work. But yes, there are many people looking at this issue and are addressing. And in terms of the medical care, we're providing them with the best medical care available to deal with the coronavirus situation. And as part of that, as I mentioned earlier, is the testing, identifying cases, providing them with the best medical care to lower the complication rates to as low as possible, and as evident, the complication rates and the mortality rates in Singapore are extremely low, and then to return them to work as part of the opening up of the economy.
Dr. Lee, the virus seems to have mutated in northern China to stay longer and slow their recovery. Does that change Singapore's strategy?
Yeah, there are a lot of reports across the world, but we have not seen any sort of specific mutations as yet that changes our analysis of the way we handle this virus. And as you know, many viruses, including this coronavirus, does mutate, and we are watching this closely to see if any of the mutations have a significant impact to the way we deal with coronavirus in general. But so far, we have not found any that would change our overall strategy.